Brought to you by Doncaster Clinical Commissioning Group.
Hi, my name's James. I've just come in because I understand that at my local pharmacy I can get a consultation. I've just changed my asthma inhalers. I just want to have a quick review to see if I'm using them properly, if that's okay.
Hello, is it Mr. Harrison?
It is, yeah.
Hi. I understand you've come for an inhaler check today.
Yes,
do you
please.
want to follow me to the consultation room?
Thank you.
So I understand this is a new inhaler for you today?
Yeah, it is, yes.
Is that right?
Yeah.
And the one you've used previously was the turbo
inhaler, yeah.
Okay, has anyone ever shown you how to use one of these?
Not properly, no. Not for a long time,
Not
anyway.
For a long time, but
yeah.
you have used one in the past?
Yeah, a long time ago. I switched into a turbo inhaler probably about 15 years ago.
Right, okay. And the reason that you've changed today, was that not working well for you, or?
Yeah, well, I just find it quite difficult sometimes when I'm short on breath with the
Yeah.
asthma. It's just try and inhale it. So yeah, I wanted to try and see if that was going to be any easier.
And were you using this as a reliever as well, or were you just
both.
You were using it as both? So today you've been given the beclomethasone as your preventer, and this one as your reliever.
Yes.
And you understand the difference between the two of them?
Yeah.
Okie dokie. Right, I just want to show you, because some inhalers, like you've had the two different ones here, they do need you to use them in different ways, and also to breathe in at different rates.
Okay.
Okay, so I've got this new device that actually I can measure how quickly or slowly you're breathing in.
Alright,
Because
okay.
the different inhalers need different rates of inspiration so that you can get the most out of your medicine.
Right.
So you get most of the medicine into your lungs,
Okay.
where it needs to be working. So I'm just going to ask you to use this device.
Sure.
Pretend you're going to use your inhaler.
Yeah.
So breathe out as far as comfortably possible.
Yeah.
And then just breathe in through there. And just want to measure how quickly or slowly you're breathing in.
Okay.
Thank you. Thank you very much. Right, now let me just show you. Can you see that red counter in there?
Yeah.
It actually went off the scale.
Alright.
Okay. For these types of inhalers, they're called meter-dose inhalers. The medicine is in a suspension in this canister.
Right.
When you shake the inhaler,
Yeah.
and you press the canister down, the device itself releases that medicine for you.
Okay.
So it's already out in a fine mist. So you just need to inhale that very slowly and gently to get that into your lungs.
Oh, right.
So does this device help you to see the different techniques that you need for the two different inhalers?
Yeah, absolutely.
Yeah.
I mean, I've been using inhalers for 20 years. I've never been shown that. So, yeah, absolutely.
So is that benefit?
Yes.
Yeah. All right.
Okay, thank you.
In Doncaster, more than 100 people a week are admitted to hospital with breathing problems. Many of these cases could be prevented by people using their inhalers properly. Previous research has shown that up to 95% of people don't actually use their inhalers as they should.
Okay, so 20 years ago I got diagnosed with asthma and I've had various types of inhalers, but I've never actually been shown anything like this service is provided today. Probably if I had, I've had 4 or 5 major asthma attacks in that period. I could have probably avoided it actually because I've not been using my inhalers correctly. Even though I was shown initially, it's nowhere near the service what's been given today.
Patients can come into their local pharmacy for a free consultation with a pharmacist to help them get the maximum benefit from their inhalers, at the same time helping the NHS by helping people to live well and keep out of hospital.